Welcome back to the Police Academy Prep series. This is Deputy Z. Today we will be going over the High Liability First Aid, Chapter 2. Just a quick disclaimer here, I know this chapter is pretty extensive, so this video might be a little long and in-depth. I 100% recommend that you go through the entire video, as I will be providing in-depth analysis, test question examples, and really get into the meat and bones of this video. I will be making a shorter version, hopefully less than half the length of this one in the future. That way, for you're on your way to an exam, maybe your drive is only 20-30 minutes, and maybe an hour and a half or 2 hours a little too long. So I would recommend listening to this video in entirety. Will give you a really good opportunity to score high on this chapter exam, and then use the shortened version for a quick refresher. So let's jump right into it. As the first officer to respond to the scene of an emergency, you can make a difference in a life-threatening situation. By applying your knowledge, skills, and abilities, you can stabilize patients and keep things from getting worse until EMS arrives. Alright, emergency medical services. The EMS system is a network of trained professionals linked to provide advanced, out-of-hospital care for victims of sudden traumatic injury or illness. This will be a test question. Again, EMS stands for Emergency Medical Services, and it is a network of trained professionals linked to it provide advanced out-of-hospital care. Jump right into this next section here. Although your duties as an officer will require you to respond to emergencies as well, the roles and responsibilities of criminal justice officers differ from those of other professional out-of-hospital caregivers. At the scene of an emergency, the criminal justice officer ensures the safety of everyone, alerts the EMS system, and is usually the first person to provide basic first aid to patients. So again, we are the first to provide basic first aid. Once EMS arrives, paramedics, emergency medical technicians, EMTs, again, EMTs are emergency medical technicians versus EMS, emergency medical services, and other responders use their advanced specialized training to provide more comprehensive care. So the question on a test might say, who provides advanced specialized care? It might be police officer, they might say EMTs, they might say, firefighters, they might say who knows what. Again, we don't provide advanced care. That is EMTs, aka emergency medical technicians. When you arrive on the scene, your initial duty is to determine if the scene is safe for you and other responders to enter. Again, when you arrive on scene, your initial duty, that's most likely a test question here as well. What is your initial duty when you arrive on scene? Make sure it's safe for you and other responders to enter. Always maintain awareness of your surroundings. After ensuring scene safety, your next concern as a criminal justice first aid provider is the patient. So again, scene safety is first, and then being a first aid provider. Your first aid duties may include PPE, gaining access to the patient, assessing a patient for life-threatening injuries, alerting EMS providers and relaying all relevant medical information, providing a patient with basic medical care based on needs you identified during your assessment, and remaining with the patient until EMS providers relieve you and transport the patient to an advanced medical facility. It is important to stay calm during an emergency. Some emergencies are life-threatening or involve emotionally charged situations with patients, family members, and bystanders. Let everyone know more help is on the way. Maintain your composure so that you can assess the scene, set priorities, and establish that you are in control of the scene. Communicate clearly with patients and responding EMS personnel so that there are no misunderstandings. Try to work efficiently, but avoid working so quickly that you make mistakes or create further confusion. As a criminal justice officer that provides basic first aid, you play a vital role in delivering emergency first aid to patients who experience sudden illness or injury within the first few minutes after it happens. The EMS system depends on your actions during those minutes, and what you do sets the foundation for the remainder of the rescue. Again, as a first responder and making sure the scene is safe for EMS and EMTs to arrive, your first goal is basic first aid, making the scene is safe, and making sure EMS gets in there. Legal and ethical considerations significantly affect your roles and responsibilities as a criminal justice officer. Whether these responsibilities include asking for and receiving a patient's consent, or documenting a patient's refusal of treatment. The public expects and the law requires you to be competent with behavior that is always above reproach. Most likely a test question here as well. Just remember this verbiage. The public expects and the law requires you to be competent. So, and of course, remain above reproach. Placing the public's well-being first during an emergency will help you reduce your likelihood of acting unethically. So just get in there, help other people, and then you should be fine with the law. Duty to act. This is a bold section, so this is going to be pretty important, definitely on the test, and pretty good high chance this is going to be on the state exam as well. So according to the dictionary, a duty to act is a duty to take some action to prevent harm to another, and for the failure of which one may be liable depending on the relationship of the parties and the circumstances. Basically saying is, we have a duty to act. If you don't act, we could be held liable, whether civilly or criminally, for not helping that. So again, duty to act means we have to do something. We don't have to be an EMS and provide advanced care, but we have to do something. Then we have breach of duty, also on the exam. Breach of duty occurs when you either fail to act or act inappropriately. So we have a duty to act, and if we don't act, then we have a breach of duty. For criminal justice officers, duty to act refers to the contractual or legal obligation to provide care. If you are a correctional officer, okay, we're not going to get into that. So if you use force, if you're in a use of force situation, you do have to render first aid after the person, is subdued, and once the person is in your custody. Provide first aid or seek medical assistance when it is reasonable based on the totality of circumstances and without jeopardizing your health or safety. And remember, because you have someone in custody, their welfare is in your hands, and make sure if something is out of your hands that EMS is arriving. Then we have standard of care. So the dictionary defines the standard or scope of care as the degree of care that a reasonable person should exercise. This is both a chapter exam and a SOCE type question. Remember, standard of care is the degree of care that a reasonable person should exercise. So just to recap here, duty to act is your duty to do something. Breach of duty is not doing that something. And your standard of care is basically being normal in your response and not being negligent, not going out of your way to hurt somebody. It's just reasonableness, right? So typically this involves a person giving attention to possible dangers, mistakes, and pitfalls and ways of minimizing those risks. Standard of care is the care that you are expected to provide to the same patient under the same conditions as would any criminal justice first aid provider who received the same level of training. For example, providing CPR is within your scope of care as a criminal justice officer, but performing open heart surgery is not. Remember, basic first aid. So if a patient needs CPR and you don't provide it, that would be a breach of duty, and you were not providing the standard of care. Then we have the Good Samaritan Act. Again, this is a solid SOCE/chapter exam question. The Good Samaritan Act protects a first aid provider from liability for emergency care or treatment performed in good faith or emergency care or treatment that would be expected of another first aid provider with equal training. So basically means if you provide CPR, maybe you break some ribs, or maybe it just wasn't good enough, or the patient was too far gone and they die. This protects you in good faith. You were doing what you could in that time based on your training experience to provide first aid care, and maybe it just wasn't efficient during that time. So the Good Samaritan Act does not stop someone from filing a lawsuit civilly, obviously, but it may provide a defense if you performed according to the standard of care for first aid providers. Yeah, this is all kind of wrapping in. Always provide care to the best of your ability, but do not go beyond the scope of and level of your training, and maintain the patient's best interests. Okay, the Good Samaritan Act, just as a side note, does provide protection for law enforcement officers when they are acting outside their jurisdiction. So let's say you work for a city and you happen to be out of that city. You realize somebody's having a medical emergency. You provide CPR. The Good Samaritan Act covers you outside of your jurisdiction. Then we have abandonment. This will be a chapter question here. Abandonment is giving up a right or interest with the intention of never claiming it. So, for example, you abandon the patient when you stop providing care without ensuring that the patient continues or begins to receive the same or better care. So basically, an example of this would be like, so a test question might come up with, you're providing CPR. I'm just using CPR because it's easy here, but you can use this in any situation. You're providing CPR for a patient. EMS tells you they're 1 minute out, and then you kind of step away from providing CPR, and you're like, okay, they're a minute out. That's pretty good. At that point, and you walk away back to your car to do paperwork, that would be abandonment, because you don't have any plan on coming back. 2, you shouldn't have stopped to begin with, and 3, they didn't receive the same or better care because now they don't have anybody there for that solid minute until EMS arrives. So you have to continue providing emergency first aid until another medical professional basically relieves you. So you're doing CPR, and then EMS personnel arrive and they say, hey, back up, we got this from here. At that point, you could then leave the scene, do whatever you need to do paperwork, go back to your car, and that wouldn't be abandonment. Then we have negligence. This is also bold. This is big. It is the failure to exercise the standard of care that a reasonable, prudent person would have exercised in a similar situation. Any conduct that falls below the legal standard established to protect others against unreasonable risk of harm, except for conduct that is intentionally, wantonly, or willfully disregarded of others' rights. So negligence could be you are doing CPR, and instead of doing it the correct way, you start punching the person in the chest. That's no reasonable person's going to punch their chest to do CPR. Obviously, given totality of circumstances and what you're dealing with, generally speaking, that wouldn't be the case. That would be negligent at that point, right? Or providing CPR on someone's neck, right? That could be negligence where it's like, okay, you weren't trained that way. No reasonable person would have even thought to do that. It's almost common sense. Now you're being negligent. So negligence occurs if all these conditions are present. This is an exam type question here. If all these conditions are present. So you have a duty to act, which us as law enforcement have a duty to act. There's a breach of the standard of care, meaning you had that duty to act and you failed to act in a certain way, like unreasonableness. You didn't act in a reasonableness. Then your causation, which is your action or inaction directly resulted in the patient's injury. AKA you didn't do CPR and then they died. Or you did CPR but you did it on their neck, causing them to die. That would be causation. You caused it somehow, whether by action or no action. And then damages. The patient was harmed. You broke bones. They actually died. They weren't able to save a limb. That would be the damages. So you really need all 4 for negligence to occur. So you had that duty to act. You didn't provide the standard of care expected. Because you either did or based on the actions you did or didn't do, you caused harm, and then the damage is obviously the result of your actions. Then we have consent. So before you begin treatment, gain the patient's consent or permission and fully explain the care you plan to provide and its possible related risks. So here we're going to go through some different types of consent. You have express consent, implied consent, and informed consent. So express consent is permission given for an action that is clearly and unmistakably stated or written by the patient or legal guardian. Express consent is positive confirmation and can be supported by verbal communication such as yes, I consent, or a physical gesture such as a nod in agreement to medical care. So basically you have someone that is conscious and saying, yes, go ahead, touch my arm, you can put pressure on here, you can treat my wounds. That's your express consent. Or you say, hey, can I help you? And they nod their head. Then we have implied consent. This is the assumption that a person has given permission for an action because of their actions, rather than explicitly express. An example is when a patient rolls up their sleeve for a blood sample or extends their arm for a blood pressure reading. So if you arrive on scene and someone's got a stab wound and they see you and they just start sticking their arm in your face saying, help me. I mean, they don't have to say nothing. They can just be sticking their arm up at you, basically implying like, hello, start treating me. That would be your implied consent. Another example would be in a situation where the person is unconscious and they could either be at risk for death or their condition deteriorating, and you're basically assuming that they agree to life-saving care if able to consent. So implied could also be, so someone's unconscious, right, and they need CPR, you would be acting under implied consent where it's like most likely they need help and they would most likely very much want that help. They just are unable to tell you that they need it. Like I said, they're unconscious. Then we have informed consent. When you think of informed consent, just think of doctor's offices, how you sign 10 pieces of disclaimer paperwork before you're allowed to go in and see the doctor. Informed consent is the person agreeing for something to happen with full knowledge of facts, benefits, risks, alternatives, disclaimers. Like I said, think doctor office, think hospitals, you're filling out paperwork. Remember that in order to refuse medical care, a patient must be competent. So a competent adult is one who can make an informed decision about medical care. The patient must understand your question and the implications of your medical care decisions. Consider an adult incompetent if they are under the influence of alcohol or drugs and have impaired judgment, or if they have a serious illness, an injury that affects judgment, a mental disorder that affects judgment, or a developmental disability. So basically, in order for them to say, no, don't help me, they have to be competent. So if you have someone that is drunk and their arm is snapped in half, they don't at that time have the ability to refuse it. Like, you basically are allowed to help them at that point, even if they're saying, no, don't help me. Or let's just say you have a child or an adult with, heavy onset of autism. They are unable to deny medical care because they most likely don't know what's best for them in that moment, and they need the care. They just don't understand that they need it. But again, competent adults have the right to refuse treatment verbally or non-verbally by shaking their head in a negative manner. So if you come across a person and they got a broken finger and they're like, no, I'm totally fine, I'm good, I don't need your help, screw off, it is what it is at that point. Obviously, offer fire rescue, offer this and that, stand by, but if they don't want nothing to do with you, then they don't want anything to do with you. Another one here too, so if a patient is unconscious and you begin treatment, right, and then they all of a sudden regain that consciousness and they are competent at that point, you feel like they have fully come to, if they ask you to stop, obviously make every effort to convince them that they need help, but if they don't, then they don't. And just remember too, if someone is telling you not to and they are competent and you continue to touch them and try to provide help, that would be battery at that point, which is a criminal charge, and technically if you have a gun on you, it'd probably be aggravated battery, depending, so just keep that in mind. I will say that being on the road for a little bit here, I've never had someone deny help for really any sort of injury unless it was like super minor, like scrapes and bruises. Most people obviously want help. Just remember too, if we're talking about like an automobile accident, you have to remember that people could be emotionally, intellectually, or physically impaired. And if you're unsure if they're unable to be competent at that point, and you're unable to provide treatment because they keep refusing, just watch them closely until EMS arrives, because they could essentially go unconscious, and at that point you could provide first aid until they become conscious and deny again. Then we have consent with minors. So in Florida, children younger than 18 years of age are minors. You must have a parent or legal guardian permission before providing care. However, if the patient or legal guardian is not available in life-threatening emergencies, provide emergency first aid based on the principle of implied consent. So again, if they're unable to provide consent, you can't get their parents there, and they need immediate help, provide that help. If they are under 18, they are able to consent at that point, you should get and they're not dying or anything like that, you should get consent from a parent. Now, if they're emancipated, you don't necessarily need the legal guardian. All right, and do know that competent adults have the right to refuse treatment for their children. Obviously, I would convince them, hey, why don't you go to the hospital just to make sure you're good, right? Then we have DNRs, what are do not resuscitate, are also known as advanced directives. We do not honor those, basically meaning that if someone's like, let's just say this lady's husband is on the ground unconscious, he needs CPR, she can't shove a DNR paperwork in his face and say, no, he wants to die. We don't withhold and honor those. Only EMS and the hospital will, so we have to provide care until we are relieved. Medical alert. So you may have a patient who wears an identification bracelet or necklace, carries a card in their wallet, or has a medical alert tattoo that alerts you to a specific medical condition, such as an allergy, epilepsy, or diabetes. Most likely a test question here as well. I've had this one. They're going to ask you what a medical alert is, and maybe types of medical alerts, aka, like I said, the card in the wallet, the bracelet. These are also really good to, if you notice that on a patient, you can quickly check it and be like, hey, this is what they have. That way you can provide that information to EMS that's on the way, or maybe provide or give you insight on how to treat that person. Remember too that on those cards or bracelets you might see telephone numbers, detailed information. Those would be medical alerts. Then we're going to talk about HIPAA laws. Make sure you know what HIPAA is, and I would probably know what it stands for as well. HIPAA stands for Health Insurance Portability and Accountability Act. Again, HIPAA, HIPAA, that is Health Insurance Portability and Accountability Act. This act protects the rights of patients and the release of patient information. We've all heard of HIPAA. Make sure you do not release patient health information without a patient's signature unless another healthcare provider needs patient information. So this doesn't necessarily apply to us too much in the road. I would just say that if you have anybody's information of any kind, I wouldn't go sharing it around with anybody unless it's with a medical professional and maybe in a life-threatening type situation where they need to know what is going on with the person. Obviously, don't discuss it with anybody else. Then we talk about scene evidence. So you may respond to a call that could be both a crime scene and a medical emergency. Some examples could be suicide, homicide, drugs overdoses, domestic dispute, abuse, hit and run, robbery, battery, gunfires. So these could be both crime scenes and medical emergencies. Remember that any item on the scene may be evidence. So if, also keep in mind too, if you suspect sexual assault or battery, advise the person not to bathe or wash. Obviously, as we understand with like sexual assault, there could be DNA evidence on the person, on their clothes. With a robbery, you could have DNA in someone's clothes, in their pockets, depending on how that happened. You don't want them to change. You don't want them to wash their clothes. You don't want them to go to the bathroom. Try to go about this by just explaining the importance of preserving the evidence so that, try to show empathy and stuff because obviously they just went through a traumatic event. And you want to do what you can to, not stress them out. And, if they got to go to the bathroom and you're telling them not to, you got to use that verbal judo and really just walk them through the importance of that. When responding to a crisis or medical emergency, effective communication helps you get needed information and provides reassurance to patients, families, and bystanders. So responding in a calm, caring, and polite way, you convey a sense of confidence and assurance to those around you. So a test question might ask, how do you respond in a crisis, medical emergency type situation? And it's going to say, calm, caring, polite, try to have confidence, be reassuring. Make sure when you're responding to the traumatic type event, a good way to keep people stable and family members stable is to divert their attention somehow. Sometimes getting them involved to help, having them move things, even if it's kind of unrelated to the incident you're at, that's always a good help there as well. Remember that you will have patients with special considerations, so be aware of their functional needs and disabilities. Take appropriate steps to ensure that communication is effective with these type of people and their families. Remember that you will also deal with patients who are blind or have limited vision. Obviously, make sure, you might find that out because they have glasses, they have canes with the red tip on it, or maybe a guide dog. Feel free to ask, hey, do you have any limited vision? Remember, too, that a patient that has a guide dog might be more concerned about the dog than their own situation. Try to keep the patient and the dog together because that dog might help them see, but might also be emotional support and make the situation a little more traumatic than it needs to be. Also be careful with those types of dogs as they usually are protective as well. Patients, you could have patients that are deaf or hard of hearing. It's not always obvious at first, but usually they will, you'll see something in their ear or they respond with their hands in a certain way. Attempt to get their attention before communicating. Make sure to identify yourself, show your identification, speak clearly and slowly so that they can understand you. Then we have patients with developmental disabilities. This is a broad term used to describe a group of conditions that affect physical or mental functioning that arise early in life. Obviously, there are many types of these disabilities, such as autism, Down syndrome, etc. Make sure you speak clearly, reassure them, and make sure you try to get the family there as well. Dementia is a general term for a decline in mental ability, severe enough to interfere with daily life. So make sure you don't get confused with dementia with developmental disability. Those are different. Dementia is just decline in mental ability. Then you have juveniles. Make sure you keep them calm. If they're younger, try to get down to eye level, move slowly. Let them know what you're doing as they're doing it, so they're not feeling like they're being taken advantage of. Remember when you could be dealing with patients that have medical equipment, so maybe a gas tank, an oxygen tank, different types of equipment on their face or arms, maybe diabetes patches. Make sure to be aware of those types of things. And then, of course, you might have patients that don't speak English, so do your best to translate, use translation services, find people that can translate for you, etc. Okay, now we're going to get into the human body. We're going to start with the respiratory system. So the respiratory system delivers oxygen to and removes carbon dioxide from the blood. So again, respiratory system delivers oxygen to the blood and removes carbon dioxide from the blood. The body can go without oxygen only for a few minutes. Keep that a note. The nose, mouth, and throat make up the upper airway that brings oxygen to the lungs. And the lungs is considered the lower airway. So upper airway, nose, mouth, throat. Lower airway is the lungs. The passage that connects the upper airway with the lower airway includes the voice box, also known as the larynx, and the windpipe, also known as the trachea. At the upper end of the passageway is a small leaf-shaped flap, the epiglottis, that keeps food and other foreign objects from entering the windpipe. So these could be test questions here between the larynx, the trachea, and the epiglottis. So just know what each of those are and what they do. And then you have the diaphragm. This is below the lungs at the bottom of the chest cavity and helps move air in and out of the lungs. Just know that infants and adults, the respiratory system does change. All right, here we go. So we got an image here of the nasal cavity, the trachea, the lung, the diaphragm being below that. Make sure to study that. Study this diagram because you could have a diagram on the test, on a chapter test saying, hey, what is this? And it'll point towards the trachea. You have to know. So know what they look like as well as what they do and their definitions. So then we have the circulatory system. So respiratory, now the circulatory. It's also known as the cardiovascular system, and it pumps blood throughout the body. So the circulatory system pumps blood through the body, and the respiratory system delivers oxygen to the blood and removes carbon dioxide from the blood. Okay. It also delivers oxygen and nutrients to and removes waste from the body's tissues. So circulatory moves the blood and has to do with the body tissues. Basic parts of the circulatory system are the heart, veins, capillaries, arteries, and the blood. So a question might come up saying, hey, what are part of the circulatory system? They might say the trachea, the diaphragm, the heart, etc. Just know the difference between what makes up the circulatory system, what makes up the respiratory system, in case you come across a question like that. Remember that the circulatory system is a closed type system, and the blood is under constant pressure, and circulation from the heart's pumping action. That's why blood flows out when you get a cut. Blood vessels are a system of tubes through which blood flows. Vessels called arteries carry blood away from the heart to the rest of the body. And vessels called veins carry blood back to the heart. So just remember, arteries carry blood away from the heart. They are oxygenated. And then when blood that obviously gets dispersed to the body through the capillaries, and then blood that has been depleted of oxygen is carried from veins back to the heart to be recirculated with oxygen. Throughout the body, small vessels called capillaries connect arteries to veins. The following major arteries determine blood flow and are used to feel for a patient's pulse. All right, so we got the four main arteries here. They are going to be important. They all will be on the test, potentially on the state exam as well. You have the carotid artery, which supplies blood to the head and neck, felt on either side of the neck. So that's your most common TV shows, etc., where you see them put the two fingers on the neck near the trachea. That's your carotid. Then you have your brachial pulse, which is it supplies blood to the upper arm, and that you feel that on the inside of the upper arm. So generally with the brachial pulse, you use that on young infants. Then you have the femoral artery, which supplies blood to the upper thigh, the leg, felt in the groin area. And the radial, which supplies blood to the lower arm and hand, felt at the thumb side of the wrist. So if someone is unconscious, you generally want to use the carotid pulse. And if somebody is conscious, you don't want to be all up in their neck, so you'll use the radial pulse in their wrist. Now we have the skeletal system. The skeletal system is the supporting framework for the body, giving it shape and protecting vital organs. This will be on the test. Know that definition. It attains mobility from the attached muscles and manufactures red blood cells. So we have the respiratory system that brings blood to the body. And then you have the circulatory system that moves blood around. And then you have the skeletal system, which gives shape and protects your vital organs. And then, of course, mobility. It also creates red blood cells. The main components of the skeletal system are the skull, spinal column, shoulder girdle, rib cage, pelvis, lower extremities, and upper extremities. So everyone's, I think, pretty solid in the skeletal system. Obviously, it's basically your bones. So anything bone related, know that. So the skull houses and protects the brain. The spinal column protects the spinal cord and is the primary support for the entire body. The shoulder girdle consists of the collarbone and shoulder blades. The rib cage contains the sternum and the ribs. It protects the heart, lungs, liver, and spleen. So the question could read, what protects the heart, lungs, liver, and spleen? That would be the rib cage. Then we have the pelvis, protects the reproductive organs and supports the organs in the lower abdominal cavity. With these definitions, make sure you do remember them both ways. So when you hear the word pelvis, know what it does. And then if you only see the definition, then you know what to choose. So because the question might come up where it gives you the definition and you have to choose the term. Or it might say, here's the term, what's the definition? So just know them interchangeably. The lower extremities, obviously the upper leg, lower leg, ankle, and foot. The upper extremities, you have the upper arm, lower arm, also known as the forearm, wrist, hand, and finger bones that comprise the arm. Now we have the muscular system. So this is the other system we have here. This gives the body shape and it protects internal organs and allows for body movement. So know that definition between muscular system and the skeletal system because as you see, they are kind of the same. So remember when it comes to skeletal, since the definition is close, with skeletal, remember supporting framework because it gives shape and protects vital organs just like the muscle set does. The difference here, though, the skeletal provides supporting framework where the muscular system allows for body movement. So if you see body movement, muscular system. If you see supporting framework, skeletal. Because as you see with these definitions, they're like 80% the same except those two different things. Again, body movement, muscles, and supporting framework, bones, aka skeletal. You have 3 types of muscles. Muscles are used for deliberate acts. Deliberate acts being, let's say, chewing, bending, lifting, and running, and these are voluntary muscles. There are muscles attached to the skeletal and under the control of the nervous system in the brain. A person can contract and relax these muscles, where involuntary muscles, which means you don't consciously think about them, they just happen automatically. So remember, voluntary, you are volunteering to do it. You are actively chewing, you're actively moving in your hand. Then you have involuntary muscles, meaning you have no control. They're also called smooth muscles. So voluntary muscles, and then you have smooth muscles. They carry out the automatic body functions. Usually these are in the walls of tube-like organs. So blood vessels, intestinal walls, etc. So a person does not really control these types of muscles. They're inside of you. Then you have another type of involuntary muscles called cardiac muscles found only in the heart. And they expand and contract the heart. So you have 2 types of involuntary muscles. You have the smooth muscles, and then you have the cardiac muscles. So smooth muscles, think intestines. Cardiac muscles, think obviously the heart. Then we move on to the nervous system. The nervous system controls voluntary and involuntary body activity. It also supports higher mental functions such as thought and emotion. So nervous system, voluntary and involuntary body activity, and then of course your mental functions. So it lets a person be aware of and react to the environment and keeps the rest of the body systems working together. The nervous system has 2 main parts. There is the central nervous system, which consists of the brain and the spinal cord. So that's pretty easy to remember. Central nervous system, just brain and spinal cord. This would be considered mainframe computer. That is kind of a quoted term there. So if you do see a question that says mainframe computer, just know central nervous system, spinal cord, brain. Then you have the peripheral nervous system. This includes nerves that connect to the spinal cord and branch out to every other part of the body. So if you're trying to remember the difference between these two, central, down the middle of your body, you have your brain and your spinal cord. Peripheral means above, below, all around. So if you ever see anything about branching out, other parts of the body, communication system, carries information to and from the brain to the other part of the body, that is peripheral because it's around you, right? So then we have skin. Skin is the largest organ of the body. This will be a chapter exam question. So just know that skin is an organ. A lot of people don't realize that. Skin protects everything inside the body, and it provides a barrier against bacteria and other harmful substances in organisms. So the question might read, you might not get, is it the largest organ or not? You might get a question saying, what provides a barrier against bacteria and other harmful substances from the body? And that might not be as clear as being skin. The question could read, what regulates body temperature? And if you think about that, you might think the heart, you might think hair, you might think, a couple different things, and that's actually the skin. So keep that in mind. So skin also acts as a communication organ. The skin receives and relays information about heat, cold, touch, pressure, and pain, and it transmits this information to the brain and spinal cord through nerve endings. So as you see here, the skin has multiple functions, and they're in this one paragraph, you could see 3 to 5 different questions. You might even have 2 questions on the skin on the test. So just know that about skin. Now we're going to talk about exposure to pathogens. So while performing first aid duties, you could encounter injured people who are sick or be carriers of infectious diseases. So they might not show any symptoms, and you might have no clue, and they might not tell you. So just keep that in mind. Know that you are, there is a chance of exposure to dealing with people that are injured. So your goal is to minimize exposure as much as you can. There are many types of pathogens, and exposure to them can occur from person-to-person contact. You could contract them indirectly through the air or through direct contact with infectious materials that contain pathogens. Potentially infectious materials include things like bodily fluids, tissues, and organs. So we're going to talk about some pathogens here. You have bloodborne pathogens and you have airborne pathogens. Bloodborne pathogens are microorganisms in human blood that can cause disease. You can be exposed to them through blood from an open wound while providing emergency first aid, or from needle sticks and other sharps related or sharp device related injuries. So that one's pretty easy. Bloodborne has to do with blood. And they might ask, well, how can you possibly contract bloodborne pathogens? It will be from sharps related or sharp device related injuries or needle sticks. Airborne pathogens. They are microorganisms discharged from an infected person by coughing, sneezing, laughing, or close contact. They remain suspended in the air on dust particles and respiratory and moisture droplets that you may breathe in. Bodily fluids. These are liquids within the human body, such as mucus, saliva, vomit, semen, vaginal secretions, and blood. Always regard bodily fluids that you encounter as potentially infectious. So, rule of thumb, if you see blood, you see any fluids, make sure you have PPE, make sure you're aware of your surroundings, make sure you aren't touching your face, things like that. Then we have universal precautions. Body substance isolation, BSI, and standard precautions. Make sure you know what the CDC is, the Center for Disease Control and Prevention. They developed universal precautions as a set of procedures designed to prevent transmission of bloodborne pathogens to first aid or healthcare providers. Universal precautions instruct providers to assume that the blood and bodily fluids of all patients are potentially infectious. So I know while on the road I dealt with somebody that was saying they had some sort of disease. So when going over the air on the radio, you don't want to necessarily say, oh, this person has this disease, warning EMS. You would say, hey, let EMS know, caution for universal precautions. And then they just know, hey, blood, bodily fluids, make sure you are extra suited up. Body substance isolation. This goes further than universal precautions and is the practice of isolating yourself from all body substances, not just blood and bodily fluids. So basically PPE and just practicing personal behaviors that reduce risk. So it is just really more of staying away than anything. Okay. So again, any bodily waste, exposed wounds, everything needs to be treated as potentially infectious under standard precautions. Standard precautions emphasize the practice of hand hygiene throughout patient care. So standard precautions is just your general washing your hands, hand sanitizer, not putting your hands in your mouth. Body substance isolation is just keeping away, isolating yourself from all types of body substances, not just blood or fluids, but skin contact, etc. And then universal precautions is just, hey, watch out for more. So you have universal precautions, which is blood and bodily fluids. Then you have body substance isolation, which is just avoiding bodies and the body itself altogether, basically avoiding people. And then you have your other universal precautions, which is just all bodily fluids. Let's see, hand hygiene. You gotta wash your hands. Make sure it's for at least 20 seconds. Dry thoroughly. Nothing too complex there. Make sure if you're going to use a sanitizer solution, make sure it's at least 60% alcohol. That could be a test question there. Now we're going to talk about some PPE. Always use appropriate PPE in any emergency where you are providing first aid. That is a barrier against infection. So a question might come up is, what is a barrier against infection? That's not necessarily a clear-cut answer, but it is actually a simple answer, which is PPE. So you have eye protection, gloves, protective clothing, masks, shields, biohazard bags, etc. And of course, hand hygiene after removing that. What minimizes skin contact with blood or other bodily fluids? Doesn't seem so clear until I say it, but that is gloves. So always use gloves, especially on the job. Anytime you're going to touch anybody, just use gloves because you never know if they have a skin-to-skin contact like MRSA or anything related to that. It's just always good to have gloves, and then even after using gloves, hand sanitizer. Okay. Let's see here what we got. Removing gloves. Your instructor is going to show you how to remove gloves. There are a couple steps here. Basically, you're going to pull from the inside, use your other hand to grab that one, and then go from the inside on the other one, and then wrap them all together so that the inside of the hand is now the outside. Then we have facial protection, so a mask, surgical mask, respirator mask. That'll be your protection against airborne pathogens, but it has to be worn obviously over your nose and your mouth. Then of course you have masks and things like that. Make sure to take proper care of your equipment. Make sure disposal of biohazard waste. That'll be more of an EMS type deal. Do know what OSHA is. OSHA is Occupational Safety and Health Administration. That'll be more of an EMS type deal. Like I said, we don't necessarily deal with too much disposal of biohazard waste. Now, bloodborne diseases. Bloodborne disease is a disease that can be spread through contamination by blood and other bodily fluids, and it is considered a bloodborne disease. So, bloodborne pathogens that are of primary concern would include hepatitis B virus, hepatitis C, and HIV, which is human immunodeficiency virus. So make sure you know what those are. We're going to go into depth on them right now. So hepatitis B. The hepatitis B virus causes hepatitis or inflammation of the liver. Outside occupational settings, sexual contact or sharing contaminated needles through drug use primarily transmit the hepatitis B virus. It can also remain infectious in dried bodily fluids or for an undetermined time. And you can transmit this disease while asymptomatic or not experience, obviously, symptoms. So you might not have symptoms yet, but you can still transmit them. So generally, hepatitis B, that's sexual contact or needles. Then we have hep C. The biggest thing with hepatitis C is know that it is the most common bloodborne infection in the United States. So if you see something about being the most common, hepatitis C, C stands for common. It doesn't, but it's a good way to remember it. Hepatitis C, C is common. That is transacted through direct contact with human blood. And then that's, of course, sharing needles, drug paraphernalia, sharps, pregnancy or childbirth, and obviously sexual contact. Then you have, so remember hepatitis B. B stands for blood. Hepatitis C is common. So hepatitis C also is transmitted through blood. So you might say, oh, but from what I've seen with test questions, if they're ever talking about hepatitis C, they're going to be talking how it's the most common. If they're ever talking about hepatitis B, they're going to be talking about blood. Okay, symptoms of hepatitis: flu-like symptoms, fever, body aches, fatigue, loss of appetite, and weakness. Now we're going to talk about HIV. This is also a bloodborne virus that attacks and weakens the immune system, and it can lead to immunodeficiency syndrome, which is AIDS, acquired immunodeficiency syndrome. So if they ask, what leads to AIDS, that would be HIV. With HIV, unprotected sex, contaminated needles, childbirth, and then direct contact with blood and bodily fluids. Then we move on to airborne diseases. Person to person through air, and it is an airborne disease. So talking, singing, coughing, sneezing, usually in a confined type space. These pathogens will enter the body through the nose, throat, sinuses, and lungs, affecting the respiratory system. All right, COVID-19. So it's called SARS-CoV-2. That is the virus that causes COVID-19. You maintain physical distance. We've all been through COVID. We kind of understand that concept there. Just know that SARS, SARS-CoV-2 is the virus that causes that. We all know the signs and symptoms of that one. Now we'll talk about TB, tuberculosis. This is an airborne disease that affects the respiratory system. So they might ask, hey, which one of these diseases or infections are airborne? They might say tuberculosis, Hep B, HIV. Just know that these ones are airborne. The other ones are usually bloodborne pathogens. So again, tuberculosis affects the respiratory system. Usually it can't be a brief exposure. It has to be more of a long-term exposure. So family members or people you're always around. Kind of know the symptoms with a lot of these diseases because they could ask a question based on symptoms. So they might say, hey, based on these symptoms, what disease do they have? Now, this chapter is large. I wouldn't necessarily recommend memorizing every single symptom that goes with every single disease because, unfortunately, a lot of the symptoms are very similar except maybe one or two. So if you want to try to memorize maybe those one or two that are different, that might be better. But if you maybe find your time not having enough time to study everything, then I would focus less on symptoms and just understand what the definitions of them are. Now we'll talk about MRSA, which is methicillin-resistant Staphylococcus aureus. MRSA. It is a type of bacteria that is highly contagious and resistant to certain antibiotics. So staph infections, including MRSA, so again, MRSA is a staph infection, occurs most frequently among people in hospitals, healthcare facilities, and detention facilities. People are more likely to get an infection if they have contact with open wounds, wound drainage, or nasal secretions of a person infected with MRSA. Signs and symptoms would be skin infections, red, swollen, or painful skin, warm to the touch, it's got pus, might look like a spider bite, a pimple, or a boil. So anybody that has any type of that stuff, steer clear. You have precautions for avoiding MRSA. I mean, showering, PPE, don't drink from the same person, ointments, all that kind of stuff. Pretty self-explanatory. Now we have hepatitis A. So it is highly infectious, but it is preventable with isolation precautions and appropriate PPE. While hepatitis B and hepatitis C are spread through contact with blood and bodily fluids, hepatitis A is primarily spread through person-to-person contact through fecal contamination and oral ingestion. So hepatitis B, I said blood. Hepatitis C, I said common. Hepatitis A, unfortunately, I would just remember that as ass. Hepatitis A, ass, because the fecal aspect is what differentiates itself from B and C. So if you see anything about fecal matter or Generally, with fecal, you could be talking about food and water because the water system might not have been cleaned correctly, has fecal matter in it, or people have fecal matter on their hands and they're pulling crops, and then those crops then go to the grocery store. So just anything about fecal matter, hepatitis A. Now we're going to talk about scene size up. Just know there are 4 components of scene size up. You have scene safety, mechanism of injury or nature of illness, the number of victims, and the need for more rescuers and special equipment. So scene size up is kind of walking on the scene, looking at the bigger picture, and then being able to translate that picture into information for EMS, for command, for other officers or deputies responding to the scene to help you. So we'll talk about scene safety. So scene size up begins as soon as you receive notice from dispatch or you come upon a scene. It takes only moments to perform scene size up, but it is crucial to everyone involved. Before you enter the scene, like I said, take an overall view of what is happening. Always maintain situational awareness, and remember, if you get injured, you may not be able to help anyone else. So that's why I always say officer safety and your safety is paramount because you're the one there to help people. You can't be hurting yourself. So if the scene is unsafe and you have no means to make it safe, do not enter. So pay attention to what you see, hear, smell, and feel. So remember, you need to use all of your senses because maybe you smell gases. Maybe you hear a sound like gas spilling out somewhere, right? You need to know these things so that you don't enter a scene that is not safe for you or you are not equipped to. All right, now we move on to mechanism of injury or nature of illness. While assessing scene safety, try to determine the mechanism of injury, basically what causes it, and the nature of the illness. So basically determine what happened. So what's their complaint? What do they need help with? What kind of injuries do they have? Then we have trauma patients or medical patients. So a trauma patient is an injured person. This is a test question. A trauma patient is an injured person, while a medical patient is a person who is ill. So when you think trauma, think legs split open, they're dying, they need CPR, they got a stab wound, gunshot wounds, that's trauma. When you think medical patient, you're thinking stomach ache, throwing up, headaches. That would be more the medical side. All right, let's see here. And then, of course, if they belong to both categories, then they need treatment for each. So maybe a patient that suffered a heart attack or lost consciousness and then had a vehicle crash, they would have their trauma injury, right, of being in the vehicle crash, and then their medical illness of the heart attack or low blood sugar. Then we have number and location of patients. The next size up part would be the number of patients. So if there's more than one, find out how many and where they are. So that's your first thing. In certain situations, such as rollover cars, patients ejected, they sometimes can be difficult to find. So you may need to spread out a little more. You may need to get witnesses, speak to other patients, bystanders, and figure out what exactly you have. And then we'll get into triage a little later on here. So the next, your last one being need for more responders or special equipment. So like I mentioned earlier, the biggest thing you need to do is look at the bigger picture and then ask for it. Simply go on the radio and say, hey, I got 3 cars here. I got at least 6 or 8 bodies injured, from minor injuries to major injuries, from cuts to leg wounds to etc. You relay that information over the radio, you're going to have 3, 4, 5 ambulances and fire trucks showing up, realizing that more help is needed. So like I said, try to relay all that information over the radio, and once you do that, it will be relayed to the correct sources. Then we have patient assessment. Every patient you encounter in an emergency needs an assessment while you wait for EMS to arrive. So your approach will usually go from general to specific. Begin with a scene size up and generally observe the patient, scanning for whether they are conscious and whether they are breathing normally. Following the initial assessment, there are 2 types of patient assessments, primary and secondary. Perform a primary assessment to identify and address any immediate life-threatening conditions. And then the second assessment is a thorough, full head-to-toe assessment of the patient. So you get on scene, you see a patient that is in need. You're looking for life-threatening. You're looking for stab wounds, bleeding, internal bleeding, unconsciousness. Once you determine that maybe that necessarily isn't the case, then you can start assessing head to toe. Like, okay, is there anything else? Is there anything we anything we missed, maybe even the patient doesn't realize. Assess for level of consciousness, LOC. So know what LOC stands for. That is a test question. That is level of consciousness. You need to determine what level they're at. So you have awake, alert, and aware, right? So you have the AVPU scale. Remember AVPU. You have alert, verbal, pain, and unresponsive. You need to know these. These are definitely test questions and SOCE style questions. So the first one being alert. Is the patient fully awake? The patient who is alert will be aware of their surroundings and can react to their environment. So they're fully awake, eyes are usually open, right? Then you have verbal. So does the patient respond when you talk to them? A patient who might not seem alert or awake but is verbally responsive, they'll respond in some sort of way. They might grunt, they might move a little bit. Basically, they're responding to you just verbally or with their body. Then you have your pain level. Does the patient respond to pain with a voluntary and involuntary movement? So some sort of stimulation, whether it is, shaking their shoulder a little bit, rubbing their chest a little bit. They might moan. They might try to pull away from you. This would be a pain level assessment. Then we have unresponsive. So basically, they're not responding to any type of stimuli of any type. So if the patient is unresponsive and CPR is what follows next, then CPR is next. When it comes to infants or children, using visual assessment is kind of key because you really need to see, since they can't respond generally as normal as maybe an adult would be, you need to really be able to visually inspect them and figure out what is going on. So if the patient is a criminal justice officer and they drop below the level of alert, disarm them to avoid possible safety concerns. So what they're kind of saying here is if they're like at an unresponsive or pain level, you don't want a cop to accidentally grab their gun and start shooting thinking someone is attacking them, is kind of what they're saying there. So now we complete the primary assessment. So regardless of their level of consciousness, LOC, you will need to do a primary assessment of the patient. During the primary assessment, the priority for care is the rapid identification and management of life-threatening conditions. So again, primary assessment is the rapid identification and management of life-threatening condition. A patient that is unresponsive will not be able to provide information and will immediately require primary assessment. Make sure to relay all vital information to responding medical personnel. Now we have our primary assessment guidelines. You have what is called MARCH, which is massive hemorrhage. Is the patient experiencing life-threatening bleeding? Then you have airway. Is the patient's airway obstructed or closed? Respirations. Is the patient chest rising and falling? Circulation. Does the patient have a pulse and blood flow? And then you have hypothermia or head injury. Does the patient have low body temperature or decreasing level of consciousness? All right, so we'll start with massive hemorrhage, which is uncontrolled severe bleeding. It is the number one preventable cause of trauma-related deaths. So basically, that's the first thing you got to do. It's critical to focus on stopping life-threatening bleeding first. So that's basically the first thing you're doing. Whether that be a tourniquet, whether that be applying pressure, packing a wound. Then the next thing you need to do after that is focus on the airway. So is the airway obstructed? Is it impeded? Do you maybe need to do CPR at this point? Then you have respirations. So to assess for respirations, you're looking at the rise and fall of the chest. Do they have equal rise and fall? Is it inadequate breathing? Is it labored or painful breathing? Is it wheezing, snoring, blue, purplish lips, or fingernails? Are they turning gray? Basically meaning that blood isn't flowing through their body. So pay attention to the depth and how the breathing is going. You may need to perform CPR or have an AED, also known as an automated external defibrillator. Then we have circulation. So you're going to assess for blood circulation by confirming the existence of a pulse and note skin color and skin temperature. So you will find a pulse by placing your fingers, not your thumb, because remember your thumb has a pulse, so you don't use your thumb, and you put it on the pulse point. So like I mentioned earlier, for an infant, you always do the brachial pulse. Where's the brachial pulse? Correct. That is in the inside of the bicep area. Now, for an unconscious adult or child, what pulse do you check? That is the carotid on the neck. Now, for a conscious adult or child, what is the last one to check a pulse? That is going to be on the wrist or the radial pulse. Make sure to determine the force or the strength of the pulse. A patient with no pulse might be in cardiac arrest and might require immediate CPR. All right, then you have your capillary refill time test. That's probably going to be a test question as well. That's basically where you squeeze their finger or their toenail bed for 2 seconds, and then after releasing the pressure, you see how long it takes for that blood and that pink color to flow back in. If it takes a long time, that means their blood flow is not adequate. And the last one being hypothermia or head injury. So rapidly decreasing body temperature would be a really bad concern, and it is common in trauma patients. Let's see. If this happens, you need to keep the patient warm and dry, remove wet clothing, get them out of the elements. For head injuries, you're worried about permanent damage and lack of oxygen and blood flow to the brain. Check their pupil size, see if there's any fluids coming out of their ears, etc. From the initial assessment, you will then complete a secondary assessment. So once all immediate life-threatening injuries have been addressed and the patient is stabilized, you will then begin your secondary assessment. During the secondary assessment, you will complete a comprehensive physical examination of the patient for all injuries and take a detailed patient medical history. Usually we don't do secondary assessments. That's more of an EMS thing. By the time you are assessing the initial assessment, EMS will arrive halfway through that initial or at the end of your initial, and they will be doing the secondary. You do have a secondary assessment guideline. So the first initial is March. Remember that. The second one is DOTS. So deformities, open injuries, tenderness, and swelling. Deformities, so abnormal shape of a body part that may indicate fractures. Open injuries, obviously open injuries, bleeding, cuts. Tenderness, so obviously pain in a certain area. And swelling, raised skin, soft tissue injuries, and fractures. Then we need to look into PMS, which is how you conduct an assessment for pulse, motor, and sensory function. So after you do DOTS, so again, secondary assessment is DOTS and PMS. PMS is pulse, motor, and sensory. Pulse, you assess for the presence or absence of a pulse. Motor, assess for motor function, basically movement. And then sensory, so you're assessing for sensation before the movement and ask the patient if they have feeling in the area that you touch. After that, you perform a comprehensive physical assessment. Like I said, you won't generally get to this point, but you do need to know it. So after you do all this, then you complete a head-to-toe physical examination. So you look at the head. You start at the top of the head, examine it by touching the scalp and the skull. You're looking for depressions. Then the eyes, you're looking at the pupils. You're looking for the dark holes in the center. Your normal pupils are round and equally sized. Constricted pupils are smaller or more pinpoint. You have your neck. Make sure you're gentle feeling it around. Look for any swelling, any obstructions in the airway. Shoulders. Squeeze the shoulders inward, and you're listening for any grinding, which may indicate any fractures. Chest and abdomen. Look to see if both sides of the chest rise and fall equally during breathing. Look for holes in the chest. Listen for noise coming from the chest walls, any sucking chest wounds, tenderness, etc. Pelvis and groin. Squeeze inward. You're looking for deformities and tenderness. Make sure everything is stable. Your lower extremities, you're looking for obviously any holes, any injuries, things like that. And then, of course, upper extremities, your fingers, your hands, your arms, and then your spine and your back. All right. Then, let's see, recording vital signs. To take a patient's pulse, place your fingers on a pulse point, one of the arteries we spoke about. Count the number of beats for 15 seconds. Multiply this number by 4 to arrive at the patient's average pulse rate. So, again, to get to the pulse rate, count the number of beats for 15 seconds, multiply that number by 4. To calculate a patient's breathing rate, watch the patient's chest rise, count the number of breaths taken over 15 seconds, and then multiply this number by 4 to arrive at the average breathing rate. So you're always multiplying by 4, and it's always 15 seconds. Then you have your ongoing assessment. This probably be a test question here. So if your patient is stable, reassess them every 15 minutes to continue to make sure they are stable. Now, if a patient is unstable, you reassess them every 5 minutes. So know that 15 minutes if they're stable, 5 minutes if they're not stable. Make sure to continue to update EMS. So some typical questions are: how many patients, where are they, which ones are high priority, and what treatment have you rendered? All right, moving patients. So in emergencies, you may have to move them for whether it's changing environments, changing medical conditions, etc. Perform an emergency move when a patient is in immediate danger or the patient's location prevents providing care to them or another patient. So if you have a patient that's maybe on the bus between seat rows and you can't provide CPR or you can't effectively provide first aid, move them out into the walkway or take them off the bus entirely if it means you need to be able to provide care for them. Then we have proper lifting techniques. Make sure to maintain correct alignment, good athletic stance, use your abdominal muscles, proper breathing, look straight ahead, lift with your legs, hips, and butt. Keep the patient's weight close to your body, limit the distance you need to move a patient. Now we'll talk about the recovery position. This is one good to know, definitely a test question, and good to know for real life. We do use this very often. So the recovery position helps maintain an open airway, and should the patient become nauseated or vomit, it'll prevent breathing restrictions such as positional asphyxia. So basically, when we get someone in custody, or maybe they was fighting with us, or maybe they just have a medical issue, rolling them on their side in this recovery position in case they throw up or in case they have trouble breathing, this allows them to relax, breathe easier, and not cause positional asphyxia. So positional asphyxia, this is in bold here. This occurs when somebody's body is in a position that interferes or prevents them from breathing adequately and insufficient intake of oxygen. So just remember, positional asphyxia, someone basically can't breathe. Walking assist is a type of move for transporting somebody. Basically, when a patient is responsive, they might have leg injuries or they can't see. You basically throw an arm around they throw their arm around your shoulder and you carry them that way. Then we have your emergency drags. This is a life-saving component of first aid. It's when you need to move a patient quickly. So they are very demanding on your muscles, so just be aware you might not be able to go very far. You have your shoulder drag, which is putting your arms under someone's shoulders and dragging them backwards. You have your blanket drag. You roll them onto a blanket and you drag them with the blanket. Your arm drag, which is where you just grab both their wrists and you drag them away. Your ankle drag, you drag them obviously by your ankles. Then you have your 2-officer extremity lift. One officer is underneath the shoulders and the other officer is grabbing below the knees, and you guys are both walking and facing the same direction. Then you have the SEAL Team 3 carry, which is 2 people, one on each side of the patient under their arms, and you carry them that way, having support under their arms. Then you have another one here called the log roll, which is basically rolling the patient to the side. Generally, if you need to turn them over and protect the neck, is when you're going to use the log roll. You only use this technique when you're assisting medical personnel generally, because they are stabilizing the head. Now we get into triage here. So you may respond to an incident that involves multiple casualties or multiple patients with severe injuries, also known as a mass casualty incident. MCI, know that for the test. Mass casualty incident, which means multiple patients, severe injuries, etc. So you could have a large car crash, you could have a shooting, etc. Okay, so when you get on a scene of an MCI and there's no active threats, your role as the first responder involves conducting a scene size-up, which we discussed. Establish command, communicate with other first responders through dispatch, and ideally you are accomplishing all of this at the same time. Once additional resources are available, your next step is to begin triage. Know this definition for the SOCE and for the chapter exams. Triage is the process of sorting and categorizing patients, and it is used to determine the order in which patients receive medical attention. The goal of triage is to do the most for the most rather than to provide extensive treatment to a single patient. So basically, you're trying to do as much as you can for as many people as possible instead of just focusing on one person. Your triage process, also known as START. Know what START is for the test. That stands for Simple Triage and Rapid Treatment. That is START. The START method of triage can be used to assess many patients rapidly. Use BSI, body isolation, and appropriate PPE. So, step 2, locate and remove all the walking wounded into one location away from the incident. So, walking wounded would be people that can walk and maybe more slightly injured. So, the goal would be to be like, hey, if you can walk, get out of here. The next thing you want to do is to tag somehow the remaining injured patients with triage ribbons. I know we're not given ribbons or anything like that because that's probably more on the rare side, but just know the colors for the test here. So red means they need immediate attention. Yellow means they need secondary or delayed attention. Green means it's a minor issue. We'll get to you when you get to you. And black means they are deceased or non-salvageable. So if they're cut in half, we're doing black. If they maybe need a tourniquet because their arm's cut off, red, right? Yellow, they got banged up in the head. They have some cuts and bruises. Maybe some way severe laceration that's bleeding, that would be yellow. And then your green would be your cuts, bruises, and your walking wounded. Then remember RPM. A lot of things to remember here. Just you really gotta go through, and I would say flashcards really help in this. You know, put down dots, put down RPM, put down start, put down PMS, and learn these acronyms here. So RPM stands for respiration, perfusion, and mental status. So assess for respiration. So if respiration rate is 30 or fewer breaths per minute, assess perfusion. If respiratory rate is more than 30 breaths per minute, you're going to tag them red. If the patient is not breathing, open the airway, remove obstructions if seen, and assess for A or B above. And if the patient is still not breathing, tag black. A lot of steps here. Not easy to remember. Just if you don't have time to memorize these, I would suggest just using common sense where if you're at step B, where do you go from here? Just kind of walk through it in your mind on what would be the best lineup for how these go. Then you would assess perfusion. Then you assess your mental status or level of consciousness. Make sure to make independent decisions for each patient. Do not, base it on perception or having too many patients in a single category. Make sure every patient is assessed as you go. So then you need to remember SALT, which is sort, assess, life-saving interventions, treatment/transport. The SALT method of triage combines many approaches from other triage processes. SALT uses the same categories as START, but also adds another category, gray. Gray meaning the patient is expected to die, but is not yet deceased. This signals to responders to focus their efforts on more immediate patients. So, sounds kind of unfortunate, but if you have this gray color, it basically means they're still alive, they're not black, but they're going to be black soon, so use your resources other places, is basically what they're saying here. Alright, multiple agency response. Let's see here. Providing care while under threat. When you are responding to an active threat, shooter incident, you may need to provide care for another officer who has been wounded. While the methods described below can be used with any patient, the section on providing care under different threat levels is primary for providing care to fellow responding officers at a scene. For this reason, the term officer is used instead of patient. Alright, direct threat care. Direct threat care, also known as hot zone / care under fire, is an environment described as a scene that can include an active threat, multiple active threats, or any immediate danger. Remember, your primary concern is, when a direct threat situation, is to stop or neutralize the threat as possible before rendering aid. What I would recommend, and what this is saying here, is to instruct the wounded officer to move out of the visual field of the threat or away from the threat. Prioritize the most life-threatening injuries first, such as massive hemorrhaging. Then you have indirect threat care. Indirect threat care, also known as the warm zone or tactical field care, is an environment that describes a scene in which the officer is out of immediate danger but not yet in a safer zone. A hot zone can change to a warm zone once the officer is in a place of relative safety or an area of cover becomes cleared but not secured. So you have hot zone, then you have your warm zone where it's safe but not fully safe. And then you have your evacuation care. Evacuation care, known as cold zone or tactical evacuation care, it describes a scene in which you are moving towards transporting an injured officer to a medical treatment facility. So again, let's go through these three. Direct threat care is your hot zone. Indirect care is your warm zone. And your evacuation care is your cold zone. That's where your EMS and your EMTs will be staging. Moving patients while under threat. So during an active shooter type incident, you will not have time to stop to provide care. So you might need to more focus on moving people from a hot to a warm zone instead of actually providing that care. Then we have a vehicle dump, which is loading the patient to a vehicle. Perform a 2-officer vehicle dump using the lifts previously discussed to transport a patient to a higher care if there is delayed access to EMS. So if you can't get to EMS, you need to throw your fellow officer into the vehicle, use one of the carries described, chuck them in the back seat, and get them where you can as soon as possible. Okay. Then we have vehicle load. You can load them feet first. You can load them head first. Honestly, whatever situation works, it's better to get them in there as soon as possible. Because if you're doing this, then it must be a severe situation. Know about the officer vest drag. So this is kind of your last option. Usually if they're wearing a tactical vest, they have some sort of hand thing to grab, and you could drag them from their vest. Or just grab from the shoulder straps here. Okay, then we move on to trauma-related medical issues. So any injury that requires March interventions is likely to result in shock. Shock is the failure of the heart and blood vessels to maintain enough oxygen-rich blood flowing to the vital organs of the body. So make sure you know what shock is. Failure of the heart and blood vessels to maintain oxygen-rich blood flowing to your vital organs. Signs and symptoms. Kind of a few here. Anxiety, restlessness, fainting, altered mental status, excessive thirst, nausea, vomiting, dilated pupils, shallow, rapid, and irregular breathing, pale, cool, or moist skin, weak, rapid, or absent pulse. So know those symptoms because that's most likely a test question there. Treatment for shock. This is again most likely a test question here. All right, let's see. Treatment for shock. If the patient has any life-threatening... Okay, for some reason... All right, there we go. The principles of shock prevention and control are to recognize the signs and symptoms and to begin treatment before shock completely develops. So, to treat a patient for shock, you need to stop any sort of life-threatening bleeding, maintain the open airway, remember CPR if necessary, elevate the lower extremities. So lay them flat on their back, elevate their feet, try to put something under their head if possible, and try to keep the patient warm. Do not give them something to eat or drink because you don't want them throwing up. Now we have types of injuries. We'll start with closed soft tissue injuries. A closed soft tissue injury is any injury that is bleeding internally or has pooling blood under the skin. So these are your internal injuries, and those are known as closed soft tissue injury, such as bruising and swelling. So again, bruising and swelling are closed soft tissue injury. The difference between bruising and swelling are they are very similar. There's a couple key words here to remember. So bruising is a closed, discolored injury that is somewhat flat, tender to the touch, and has an obvious discoloration, black and blue. Bruising occurs from leakage of blood under the skin from small blood vessels. Swelling, also a closed, discolored injury that is raised, firm, and a painful lump. Swelling occurs from larger leakage of blood under the skin from larger blood vessels. So, bruising and swelling are familiar, but bruising is going to be more flat, and it's going to be a little bit of leakage of blood, where swelling is going to be a lump, it's going to be more firm, and it's going to be a lot more blood. So remember, the closed soft tissue injuries can also be life-threatening depending on how much blood is leaking underneath. Then we have closed treatment for these types of injuries. So cold packs. Besides that, really not a whole lot we can do here. Just monitor for shock. Then you have your open soft tissue injuries, which there are a few here. You have your amputation, removal, or loss of limb. Evisceration, a wound where the organs protrude outside the body. These are test questions. Hint, hint. Puncture wounds, wound caused by a sharp object that penetrates skin. Laceration, cut to the skin. And an abrasion. So an abrasion would be like scraping your skin. So you're skateboarding, you scrape your knee, that's an abrasion. Laceration is just a simple cut. Puncture, obviously you're puncturing the skin with some sort of sharp object. Evisceration, no, that's where your organs are hanging out of your body. And amputation or removal of a limb. Okay, alright. So then we have 3 types of bleeding. Arterial bleeding, venous bleeding, and capillary bleeding. So arterial bleeding would be bright red blood spurting and flowing from a wound. It's just going to be a severed or damaged artery. So if they say, hey, you have a wound from a damaged or severed artery and it's spurting, what type of bleeding? This is arterial. Venous bleeding is going to be dark red blood. So arterial is bright red blood. Venous is dark red blood, and it's going to have a steady flow. Then your capillary bleeding is more of like an abrasion. It's going to be oozing dark red blood slowly. Different methods to stopping bleeding. You have your tourniquet. Test questions here. It's a device that restricts the flow of blood. You have dressings that are sterile pads applied directly to a wound to promote healing and protecting the wound. Then you have hemostatic gauze or dressing, and is a wound dressing containing an agent that promotes blood clotting. And bandages, coverings that hold dressings in place. So don't confuse dressings with bandages or bandages with dressing. So your dressing is going to be like the gauze pads, and then your bandages is going to be what wraps around or holds those gauze pads in place. So think about the dressing with the gauze pad and then putting a band-aid over that to hold the gauze pad. So bandages secure dressings. Okay. Then you have your major life-threatening bleeding. You have your extremity bleeding. So that's obviously going to be any bleeding from your arms, your legs. And then you're going to have junctional bleeding. So real quick, with extremal bleeding, you're generally going to use something like a tourniquet for. Obviously high and tight. Then you have your junctional bleeding, which is bleeding that occurs at a junction of the torso or the extremities, such as like your neck, armpit, groin areas. Tourniquet's not going to work here. So you're going to need to usually apply some sort of pressure, maybe an Israeli bandage, hemostatic gauze. You might have to stuff the wound, things like that. Then you have your minor bleeding. That would just be bandages, gauze pads, etc. Then we have impaled objects, which would be puncture wounds. It's usually a result of an object, blunt or sharp, penetrating the skin's soft tissue. Obviously, the severity depends on the location. If you're going to treat a patient for impaled, obviously don't remove it. Just stack gauze around it to protect the bleeding there. Human and animal bites, they can become affected, so just kind of know how to treat those. Gunshot wounds, they can be serious because of the fragmenting or the bouncing around. So your gunshot wounds are generally going to be treated by, your sucking chest wound or your chest seals and things like that. We have spinal head and neck injuries. So spinal injuries, that's going to be an injury to the head, neck, shoulder, back, and abdomen that would cause injury to the spinal cord. Know the symptoms of that. So persistent erection, constant or intermittent pain or tenderness in the neck or back, weakness in the arms or legs, tingling and numbness. Make sure if you perceive that there might be a spinal motion type injury, make sure that you keep their head stable, neutral position, don't allow them to move. Make sure you know what the jaw thrust maneuver is. You use this maneuver when you believe an unresponsive patient to have a neck or spinal injury. What you do is you come by their head, you grasp the angles of the patient's lower jaw on both sides, and you press down with your thumbs as you lift the jaw. Head, face, and scalp wounds. So know these types of wounds and how to treat them. Usually some sort of direct pressure or some sort of gauze and pads. Let's see here. Then we have your TBI, traumatic brain injury. Know this for the test. It is a brain injury that occurs when sudden trauma causes damage to the brain. This can occur when the head suddenly and violently hits an object, when the brain hits the inside of the skull, or when an object penetrates the skull and enters brain tissue. So you got coma, seizures, vomiting, paralysis, etc. Then you have your infant TBI. So an infant or child younger than 6 years of age is usually caused by violent shaking or some sort of blunt impact. Make sure you know what shaken baby syndrome is, SBS, and it's basically signs of child abuse. Alright, then we have eye trauma. So know how to treat eye trauma. I would say not necessarily a SOCE type question, but obviously most likely going to be on the chapter exam. Neck injuries. So a lot of with these injuries, there are a lot of steps on how to treat them. I personally wouldn't go into too much time, unless you have time on your hands, to really remember every single step. Like I said before, just try to use common sense with what probably goes next after what they're asking. If they do ask a what's next in the step process type question. Now we have chest injuries. We have a closed chest injury results from blunt force trauma. So damaging internal organs, internal bleeding. Then we have a flail chest injury. Occurs when 2 or more adjacent ribs are fractured in 2 or more places due to blunt force trauma. This causes the broken rib pieces to move in the opposite direction from the rest of the chest as the patient breathes. So intense pain. Then you have an open chest injury. Occurs when there is a penetration through the chest wall. Air and blood enter the area. So the main treatment for this open chest type injury is to seal the wound. So your sucking chest wound. Not your sucking chest wound, your chest seals and stuff. Then you have a sucking chest injury, which is a type of open chest injury involving a larger hole in the chest wall. As the patient breathes, the air moving through the open hole in the chest creates a sucking sound, and their chest isn't going to rise and fall as it normally would. Alright, let's see. We have improvised chest seals. Let's see. To improvise, like if they use a chip bag or some other type of packaging or anything like that over a wound. Alright, then we talk about evisceration. An abdominal evisceration, test question here, is an open wound where the organs protrude from the abdominal cavity. Alright, so large abdominal eviscerations may produce large amounts of blood and bodily fluids. So obviously PPE, eye protection, etc. Make sure if they have organs sticking out of their abdomen like that, use moist dressing. Don't use dry dressing. Okay, know your genital injuries. Most likely it's going to be ice packs. Don't insert anything into the vagina. If you see a part that is separated from their body, make sure to pick it up and keep it wrapped in a dressing. Alright. Then we have our classification of fractured bones. You have your open fracture, which is a fracture where the skin at the injury site is open and the bone may protrude through the skin. A closed fracture, obviously the fracture where the skin of the injury site remains intact. A dislocation occurs when trauma forces the end of a bone from its normal position and it comes out of the socket at the joint. So we all know what dislocation, dislocating your shoulder and things like that. Amputation, that is a loss or removal of a limb or body part such as a finger, toe, hand, foot, arm, or leg. You have 2 types of amputations, complete or incomplete. So either their arm is completely separated or maybe it's mostly separated and it's kind of hanging. Do note that both usually require a tourniquet. Alright, burns. So we have burn depth classifications. They're either going to be major, either minor, major, or life-threatening. So your types of burns here are going to be superficial burns. That is your first degree burn. Again, these are test questions here. Superficial is your first degree. So it damages the first or the outermost layer of skin. It's red and painful. Prolonged exposure to low intensity heat and things like that. So your sunburn would be your example. If they're like, hey, what's an example of a superficial burn? Sunburn. Then you have your partial thickness burns, which is your second degree burn. It damages the first two layers, which causes swelling and red, white, or splotchy skin, blisters. Usually this is going to be like boiling liquids, explosions, hot grease, or flames. Then your full thickness burns are going to be third degree. It damages all skin layers and often affects the muscles and nerves as well. That's when you get the waxy, white, or charred looking skin. And the patient may feel no pain because all the nerves are burned off. Okay. Your burn types. You have thermal burns caused by exposure to heat from any source. Inhalation burns caused by exposure to smoke or chemicals through the respiratory system. Chemical burns caused by exposure to liquid or dry powder. Power on this should be powder. Looks like they misspelled that here. And then your electrical burns caused by exposure to electrical current or lightning. Okay, burn treatments here. Know how your treatments, like I said, there's a lot of steps here. Study what you can out of these. Overdose. Patients who misuse substances can sometimes experience complications such as overdose, which is when you take too many of the substance or more than the recommended amount. Alright. Let's see what we got here. Know what naloxone is. Let's see here. We're going to talk about drugs here now. Alright, fentanyl. So fentanyl prescriptions are for pain management and delivered through injection, transdermal patch, flavored lozenges, dissolvable tablets, and nasal spray. So know that fentanyl is a synthetic opioid and it mimics morphine, but is 100 times more potent than morphine and 50 times more potent than heroin. Okay, alright. So make sure you know when responding to fentanyl that you have to have PPE. Make sure you have other deputies present just in case you do get in contact with that. Do you know what withdrawal is? It is a physical, mental, and emotional response to suddenly or slowly quitting the use of substances. Diabetes. Test question here. Diabetes is a chronic illness that influences how the body turns food into energy. Diabetes causes the body to not produce or properly use insulin. Know the definition of insulin. It is a hormone that converts sugar, starches, and other food into energy needed for daily life. You have 3 types of diabetes. Type 1, diabetes in which the body does not produce or produces very little insulin. Type 2, diabetes in which the body does not use insulin properly. And gestational, which means diabetes that may temporarily develop during pregnancy. Okay, alright. So make sure you know your signs and symptoms of a diabetic emergency. You get that intoxicated appearance, confusion, dizziness, drowsiness, that sweet, fruity, acetone-smelling breath, blurry or double vision, irregular breathing, seizure, convulsion, loss of consciousness. Okay, know what a seizure is. It is a burst of uncontrolled electrical activity between cells in the brain. They can range from a blank stare into space or random shaking to twitching extremities. Person can have single ones, recurring seizures, etc. Asthma. This is a respiratory condition in which the airway passage narrows due to swelling and mucus, which causes breathing difficulties. Signs and symptoms of an asthma attack are breathing difficulty while exhaling, rapid breathing, bluish skin, and a wheezing or whistling sound. Stroke. A stroke damages part of the brain due to the rupture or blockage of a blood vessel, often caused by high blood pressure, smoking, heart disease, or diabetes. And it's where the brain does not receive the oxygen and blood supply that it is needed. Make sure you know the difference between a stroke and a heart attack, as they are somewhat similar, or rather are confused with each other. A heart attack occurs when a clogged blood vessel blocks the blood flow to the heart and it does not get the oxygen it needs. So heart attack is the heart's not getting blood, aka heart attack, and stroke is when the brain is not getting what it needs, or you're getting a rupture in the brain. Okay, heat-related injuries. You have heat cramps. Make sure you know your signs and symptoms of all of these. I would say these are worth learning. So your heat cramps, you might get headaches, you get cramps, warm and sweaty skin. Then heat exhaustion, so that's the lowest level. Then you have heat exhaustion, which is a medium level. You have headaches, loss of appetite, and vomiting. You have dizziness, fainting, moist, cool skin. And then you're transitioning to heat stroke, which is the worst. That is headache, loss of appetite, vomiting, and your symptoms are seizures, hot, dry skin, and rapid pulses. So know when you have warm, I would say for the test-wise, how they framed it, at least for ours, is they asked the symptoms of like warm, sweaty skin is heat cramps. And then your moist, cool skin is heat exhaustion. And then your heat stroke is the hot, dry skin. Okay. Heat stroke is a life-threatening emergency that requires prompt EMS transport. Then you have your cold-related emergencies. So you have hypothermia and frostbite. So to remember the difference between hyper and hypo, hypothermia, think cooling. So hypo, you're cooling, and excessive cooling of the body's core temperature. And then frostbite, a localized injury from overexposure to extreme cold. So frostbite is a localized injury. All right. Causes of hypothermia can include overexposure to cold caused by weather conditions. Frostbite is also known as a local cold injury, is a freezing or near freezing of a body part. All right. So let's talk about poisoning. Poisons are substances that may cause an allergic reaction, injury, or death if introduced into the body. Poisons can be solids, liquids, or gases that enter through ingestion, inhalation, injection, or absorption. Okay, all right. Know what anaphylactic shock is? It is a life-threatening emergency. It's also known as anaphylaxis. It results from insect bites or stings, medications, pollen, foods, chemicals, or any substance that triggers a severe allergic reaction. So anything that has to do with allergic reactions, that's anaphylactic shock, also known as anaphylaxis. Okay, now we're going to talk about helping with labor. When called to assist a patient in labor or in the process of giving birth, size up the scene and perform a primary assessment. So remember that labor occurs in stages. I would say most likely, unless you're in the middle of nowhere, EMS is probably going to get there on time, and thankfully you won't have to deal with this too much here. If you see the baby's head beginning to show, you know you're preparing for delivery. Make sure to assist with delivery. Know that the head usually comes out first. You're going to have to care for the newborn, make sure it's crying, wipe it down if possible, keep it warm. When it comes to labor, know things like umbilical cord. It's a narrow cord of tissue that connects a developing embryo or fetus with the placenta during pregnancy. The placenta is an organ that forms during pregnancy and attaches to the uterus and the umbilical cord. Know the types of delivery complications and how to get them out. So your umbilical cord around the neck is a big one. Obviously could cause breathing. Your goal would be to loosen or unloop it if possible. Then you have umbilical cord prolapse. So that's where the umbilical cord comes out of the vagina before the newborn, and this is a life-threatening emergency. So this is one of those ones that you need to notify EMS, and that is for them to, that's kind of beyond our first aid care. And then know about your breech delivery. So if you see feet or butt coming out first, this is something that EMS needs to know so they can get there as quick as possible. Again, this is also one of those beyond our general care. Obviously, never try to pull the baby by its feet. And then, of course, your last one here, excessive bleeding after delivery. So if they're bleeding more than normal, continue to just observe them. This could become severe, life-threatening. just continue to update EMS in the meantime. And this will now conclude our chapter 2 here with our first aid. This was a bit of an extensive chapter. Like I said, with such a long chapter, it's really hard to remember steps with a lot of these things. I would focus on definitions and terms, and once you have those down pat, I would then focus on the steps for each one if you have time to study those. Like I said, I'm going to try to create a shorter version of this one that focuses more on terms and bullet pointed terms. That way you have a faster and shortened video to watch for test days and things like that. So stay tuned for more.